We want to start off with a reminder that we are not doctors. Before you make any changes or try something new, always consult with your doctor and medical team first. Chronic illness can vary from patient to patient, so it's always best to consult with your own doctor for what is best for you.
Hello and welcome to IBD Determined. I'm your host, Mason Harvey, and I speak from the role of a patient, and I have Crohn's disease.
And I'm Michelle Harvey. I'm Mason's mom, and I speak in the role of a caregiver on this podcast. And today we are going to be talking about something that we've touched upon, we've discussed in other podcasts, but I think it deserves its own
video.
Yes.
Because it's quite a big
Yeah, and
thing.
I think it's just important for some of you out there to either learn more about it or to actually just understand it. Maybe you're going through some of this and didn't realize it was connected to IBD. And so at any rate, I think you guys will learn something.
Yeah.
And this is going to come out 2 days, I believe, or day after New Year's. So happy New Year's.
New Year's, yeah. Happy New Year's, yeah.
That is listening.
2025.
Yeah, it's exciting. It's exciting. We made it too. We started the podcast in 2023.
That's crazy, actually.
So
yeah. 2 years almost.
Yeah, we'll be in the summer. We'll hit 2 years.
Wow.
But crazy.
We're in 2025 though.
Yeah, it's exciting. So we are here to keep doing this as long as you guys are
interested and happy and learning something new.
Yeah, it's important. So what we want to talk about today is going to be something that many of you, like we said, you may have experienced it. Many of you may have not, but it is joint pain.
Yeah, so arthritis, but it's definitely something I experienced quite a lot when I got back from the hospital.
So when did you first have joint pain then? When was the first time you remember having joint pain?
I can't remember exactly, but I feel like I might have had maybe just a little bit before the hospital, but I really think it wasn't as bad as it actually was afterwards, because I probably had just the ankles. It was just the ankles. That's all it was at the time. But then when I got back from the hospital, it was my wrists, it was my hip, it was my back, it was a lot of other things. And so it just got worse over time.
So did that pain, so I mean, I know the answer, but for our listeners, did it keep you from enjoying activities?
Yes.
That you used to enjoy?
Yeah. And obviously the back was the worst one. The other, if the back thing wasn't there, obviously joint pain and wrist pain and the leg pain and the hip joint pain, whatever, that would have definitely stopped me from doing things and being more athletic, more like running or golf.
That was one of the big ones. That's why I asked you that, because one of the first signs we knew it was improving was because you could swing
my golf club. Yeah.
Golf club. And we're not talking like we're talking a full swing. So not just like a putt.
No,
but
the entire swing with the driver.
Yeah. And so I remember you running out and telling us that you tried it and you're like, I can do it. So that was a big deal. So it does affect things. And if you had been, a runner, if you had played sports, I'm sure it would have affected those things as well.
Definitely.
But yeah. And so some of you out there listening may understand this or relate to this. And I guess also I want to ask you, for those listening, even though I know, how did it get better? Do you remember when it got better?
It got better when I was actually put on Stelara. It actually cleared up. I think it was actually one of like the first things that happened. The first thing that happened is not that my symptoms were going away. Well, obviously the joint pain was a symptom, but it wasn't getting rid of the Crohn's, stereotypical symptoms. But the joint pain went away almost instantly.
Yeah, and that's what I remember. That was what was so exciting, was thinking that this is helping inflammation, because that was a sign.
If you weren't sure if it was because I was off Remicade.
Yeah. Well, this is going to be interesting for you to learn, because as we get further into this,
it's a learning experience for me and
for the viewers, because you're going to see how individual that this can be and how different it can be, and what a doctor may say versus what you might experience. And so I think that's why it's important to talk about. So with that, we're going to start with some facts. So 30% of people with Crohn's or ulcerative colitis have joint pain.
Wow.
So 30%. So 3 out of 10. 3 out of 10
that's
people.
A lot.
And so that's, it's not a lot, but it's enough.
It's enough, yeah.
Yeah.
It's not like 10 or 5%. It's 30%, which that's
so that would suggest that
quite a bit.
With the amount of listeners we have, some of you do have joint pain and have experienced this. And joint pain, as you kind of mentioned earlier, is known as arthritis, and it is an inflammation of the joints, which does, this makes a lot of sense because
Crohn's is all about inflammation,
right? And it's often associated. So when you hear the word arthritis, right, usually it's associated with someone who is maybe older, with advanced age. But it also affects younger patients and kids.
Younger patients, yeah.
Yeah. So with this disease,
getting just a taste of the old.
Yeah, it's not to say. So and arthritis can affect people without IBD. So this is, that's an aside. But typically, that's what you associate with. So I don't think a lot of people think maybe who have Crohn's or who have ulcerative colitis may think that they could have arthritis too, because maybe they think they're too young. Maybe they don't realize it's association. So it's important to talk about. And also important to mention, all of this is coming from the Crohn's and Colitis Foundation.
This is very good source.
Yes, and also Harvard Health. So that's where we're getting information today. And in addition to this pain, you might experience swelling, or also they say a reduction in flexibility, which
that makes sense.
Makes sense, right?
Because if you have arthritis and your wrist hurts, obviously you're not going to be able to do this, or you're not going to be able to do it as easily because that will hurt. And your body will say, I don't want to do that because that hurts.
I feel like...
And it will have other...
I feel like seeing you now versus when you had it, your back, you held your back differently.
Yeah, I did. Actually, yeah. When I'd walk too, at a different...
I feel like you walked a little differently. And I think even like now that we've been running and doing things, you can see that your flexibility is
a lot better.
Yeah. So, obviously with golf, like we talked about, there was that, but this is also something I wanted to ask you because one of the facts is said with arthritis that's associated with IBD, the inflammation can involve like a few of the large joints, and it tends not to involve both sides equally. So you may have like your knee on one side, your elbow, your wrist on the other side.
So it's not going to be symmetrical.
It's not usually symmetrical. Do you remember if that was the case for you? Because I know it's been a few years now. But...
I feel like it would kind of jump back and forth. Like maybe this wrist would hurt sometimes.
Yeah.
And then this one would hurt.
Right. They weren't the same.
It was uncommon if they were together.
Okay. So people who have something like rheumatoid arthritis, like they'll have like usually both 10 sides, like both wrists would be affected equally. So, and again, these are, I know with science and with health, things can vary, but this is what is typical. So we're just using, guess what's typical. So
what's usual.
So that was interesting. I read that because I was like, wonder, because I don't remember you complaining about like both your wrists and one wrist would bother you.
Or the other.
Yeah. Or your one ankle would bother you, your one leg. It wasn't, and then it would hop, like it would go to the other side.
Which is nice. It's kind of nice, I guess. So not everything is hurting at once.
So joint pain can be worse with a flare or when you are more symptomatic, which makes sense because your inflammation will be up.
Yeah.
So that's another sign to look for that you could be starting to flare or...
Because one of a few of my first signs is usually loss of appetite, losing weight, and then usually it's like joint pain.
Yeah, usually you start to feel... Yeah, because I'll keep an eye on that.
Because it's usually my ankles.
Okay. Yeah.
I think.
And it's interesting because it's sometimes I think for kids out there listening, it's hard to know because I think a lot of you may get growing pains also because you're growing. And so I think it could be confusing.
It's kind of hard to tell.
It's like, am I having pain? So it's always best to let your doctor know. So that way they can help you determine if this is something that's just age related with growth or if it's something more. So
something more like arthritis.
So worth mentioning. So now we're going to talk about the different types of arthritis.
Okay.
And there's
quite a bit.
There's peripheral arthritis, axial arthritis, and ankylosing spondylitis.
Wow.
You were diagnosed with peripheral arthritis.
Wow. So that must mean when I look like this is my
Your peripheral.
vision. That means
well,
sure.
So we're going to talk about the differences. And, I think that these could also be, just for those of you listening, I think these can also maybe change. I don't know. Maybe certain times, maybe you may develop a different type of arthritis. So I don't know how that goes, but I do know it's important to let your doctor know so they can get you the correct doctor to help you and to figure out if it is changing or if you have a different diagnosis. So it's important to know so you can treat it and also understand
as
it.
As you can.
Yeah. So let's jump into peripheral arthritis.
Yippee.
So this is what you were diagnosed with. So let's see how much of this connects to you or doesn't. I think that'll be interesting. So it affects the large joints of the arms and legs, which can include elbows, wrists, knees, and ankles.
Okay. Yeah. Wrists.
It can move from one location to another.
Okay.
And treatment of the IBD itself usually helps resolve the joint discomfort.
Yeah.
It tends to be more common in ulcerative colitis or Crohn's disease when it's in the colon. Doesn't mean that it has to be, but more common. And actually, so what I think is interesting with this is you have pancolitis when you were diagnosed.
Yeah.
Your colon was very affected. So
that makes sense, actually.
It could make sense which is probably why a doctor looking at your symptoms and a doctor looking at everything is going to diagnose you with this. The next one is axial arthritis. And so this is where it's interesting because what I noticed with peripheral is it didn't mention anything about the back. Right? And
that's interesting, actually.
Which is interesting. And so axial arthritis is pain and stiffness in the lower spine and joints at the bottom of the back. Now, yours was a little higher up.
But it did include
that. Yeah. Right. So symptoms can occur, and this is especially in younger people, months or years before IBD symptoms appear.
That's weird because I never really had it.
No, you didn't. But it can cause permanent damage if the bones of the vertebral column fuse together.
That's right.
And that can create decreased motion of the back. So, like it said, one of the examples said in some cases, like even taking deep breath might be difficult because you could have a restriction in the rib motion. And it also generally subsides by the age of 40.
So it goes away.
So it can subside. So the way it's usually treated is with biologics. And that kind of makes sense because you're going to be treating IBD with biologics. So it would probably help both. And
hand in hand.
Yeah. And the other one is ankylosing spondylitis. And this is a more severe form of spinal arthritis, which affects 2 to 3% of people. So that's like 2 to 3 out of 100 people.
That's a lot more rare.
Yeah. This occurs more often in Crohn's disease, though, than with ulcerative colitis. So that could explain why it's a smaller percentage with an IBD because it's more focused on one group.
Yeah.
So in addition to the spine and joints at the bottom of the back, it can cause inflammation of the lungs, heart, and eyes. They did not diagnose you with this. Yeah. But important for us to know so you can keep an eye on it. And we also know to ask questions if we want to ask our doctor about it. We also know more about it. So it usually strikes people under the age of 30.
Okay.
Mainly adolescents and young adult males.
Interesting.
And it appears with a loss of flexibility in the lower spine, which is also interesting. So it's similar to the axial arthritis, except there obviously are other differences. It's a more severe form of it.
Yeah. And it's a lot more rare.
And so biologic treatments can help reduce joint damage and complications with it. So arthritis associated with IBD typically gets better as your intestinal symptoms improve. So again, it's just a sign, I think, the inflammation in the body. And it's just it's important because so many people just think of this disease as like digestive system.
Yeah, just that. That's all. No, and there's a lot more to it.
There is. And so it's important for you guys to stay educated and look at other factors of this disease so you know what to look for too. It's really important that this should be discussed more often, I think. Definitely. And arthritis associated with IBD tends to be chronic, which means long lasting, though it may get better and worse over time.
Yeah, that's
so
right.
it can fluctuate.
It's a gamble.
Right. But it's also like flaring, right?
Yeah.
Because over time you can be better, you can have worse times. And so I think it makes sense why it does that.
Mm-hmm.
Yeah. And there's no way that they know of to prevent arthritis and IBD.
I mean, they don't know a way to prevent IBD itself. And if arthritis is a part of it, it's kind of part of the package. So
right.
Yay.
It's something that can come with it. And let's talk about some treatments and how, different ways they can treat it. And this is where I think it is kind of interesting with your case. And I think you'll see why as we're going. You'll probably see it before I even say anything. For peripheral arthritis in a person who doesn't have IBD, they would use an NSAID, which is like ibuprofen or aspirin. Yes.
Yeah, okay.
And that might be recommended to help reduce pain and swelling of the joints. But in someone with IBD, like, as you know, NSAIDs are not recommended.
You're not allowed to use ibuprofen or aspirin. You have to instead use things like Tylenol.
Right, which is going to be different. But it's important to talk to your doctor. Maybe some of you out there do use these, but for the most part, I think a lot of you have probably been advised not to. And there's a reason for that. And, you have to
do an episode on that next.
Yeah. And because we could go into that, but we'll save that. Yeah, another episode.
About NSAIDs.
But NSAIDs are not recommended. So you wouldn't want to, like, Mason doesn't take ibuprofen, he doesn't take aspirin or anything like that. So there's also corticosteroids can be used to treat arthritis symptoms as well as IBD. We know steroids are often used.
Yeah.
So it says, one of the things and I took note of this, that peripheral arthritis is often managed by controlling the amount of inflammation in the colon, which makes sense because they said a lot of people with that diagnosis, if they do have Crohn's, the emphasis is in the colon.
And my colon, I think, is doing better. So it makes sense because I don't have any joint pain.
That makes sense. Yeah. I mean, I think even ulcerative colitis patients, what I had read is when they remove the colon, sometimes the joint pain goes away.
Oh, okay.
Because they've taken that. It's gone.
That's interesting.
So it is interesting. Axial arthritis doesn't seem to improve as inflammation gets better. That's
not fun.
Yeah. So it's a little different.
So you're kind of just stuck with it.
So here's some of the treatments. Methotrexate. And that's an immunomodulator, not a biologic, but that has been shown to help IBD associated joint pain. So what I think is interesting.
Mine didn't get better when I was on.
No, it did not. No. So in fact, I think it made it worse.
Yeah.
Because that's when we started. So what I remember is when you were on these is when you started experiencing joint pain.
Yeah.
And so we at the time, no one had told us that joint pain was associated with IBD. This wasn't something we had learned when we were in the hospital.
So something new that was happening.
We were like thinking the whole time, because these all come with so many side effects. Oh, this is another side effect of something. Yeah. And nobody mentioned at the time that no, the joint pain shouldn't be a side effect of the methotrexate. Yeah. So what's interesting is methotrexate is one of the ways they treat it.
Yeah, but it seems to make it worse for me. However, methotrexate isn't going to make it worse. I mean, obviously it kind of did for me, but Crohn's disease is different for everybody, and so are treatments. And so don't worry if you're on it. It will most likely help the arthritis.
And I think that's important for those of you listening, because maybe some of you are on it and you're experiencing this like Mason did. And so it might be good to hear someone who it didn't work for, but something else did. Yeah. There's other options.
There's some
or to figure out maybe there's something more going on with the inflammation. The other one is biologics. This is another interesting one for you, such as Remicade, which is infliximab, Humira, which is adalimumab, and Cimzia, certolizumab. Those have all had successful results in reducing joint pain and swelling. And again,
this is
you
weird.
were on Remicade,
and that almost. We're not sure if it made it worse or if it was just being neutral.
But that's when you were worse. You were on methotrexate and Remicade, and it was worse. So you were on two of those.
Yeah, and then the second I got off of Remicade and got onto Stelara, it got better.
Yeah.
And Stelara isn't even...
It wasn't, but I found it on another site because I looked it up because I'm like, this has to be something here. Another site, which is the Harvard Health, did suggest that Stelara can also be effective in treatment.
All right. At least I'm not, my case is not crazy.
Right. And so I think though what happens is because Stelara is newer, well, there's so many that are newer now than Stelara, which is so exciting actually. So, but when you started, Stelara was one of the newest. There wasn't things like Skyrizi yet that we'd heard over other ones. So
it's actually crazy how much has happened in the 4 years that I've been diagnosed.
Right. If it does to me, it feels like there's been so much growth in the biologic industry.
Imagine it in 10 years.
Yeah. And what's cool is which I don't know. Well, you know what? We'll wrap up with. I'll talk about Spire after, because I don't want to like interrupt this. We're almost done with what we're going to talk about, but it's relevant to what we're talking about. Yeah. But I thought was interesting is that Stelara was mentioned on another site, but on the Crohn's Colitis Foundation it wasn't. So depending on when the research and when they've started finding these results may be included, maybe there may be more that'll pop up besides Stelara, but Stelara was mentioned on a different site. But what's interesting is the two that were known, the biologics like Remicade, Humira, and Cimzia,
the methotrexate.
And methotrexate, both of those did not
work. Yeah,
did not work for you.
It's weird because that's what they're meant to. Well, not meant to do, but that's what they're known to help with.
Right. So just an FYI that like if you're being treated and it's working for you, awesome. And you should, it definitely is something that works for, it sounds like the majority of people, but it's also important to remember not to get frustrated and know that if it isn't working for you and you're like, well, is this supposed to work? Well, it didn't for him, but we found something else. And I think also just getting that, to me, it makes sense why it wouldn't work because your inflammation was not under control with Remicade and methotrexate. And so it makes sense why you would still have that joint pain because your inflammation was so out of control. But what's interesting is the joint pain really started when you went on those.
Yeah.
So interesting.
Because it would have been fine, I guess, if it just kind of kept it neutral.
Mm-hmm.
But it's weird that it almost made it worse.
Yeah.
And they're supposed to help.
So, I don't know. Yeah. So there's something for everybody. And it just goes to show with this disease, there's no easy answers. Unexpected. Yeah. Maybe someone listening to this will be able to talk to their doctor and get help you guys need. Yeah. So Remicade and Humira have also had great success in treating ankylosing spondylitis, and that's used as a primary treatment for that. There's other treatments too that were mentioned. They said like using like occasional like heat, rest for the joint, or exercise.
Heat did help.
Yeah, that's what we would do with you. But then there's exercise with a physical therapist also. So those are a few of the different things.
Bunch of different things you can do for it if that doesn't work.
Mm-hmm. But one of the things, so I want to bring it up really quick because we spoke at Spire last week. I don't know, whatever it was now, like a week and a half ago. Yeah.
By the time this comes out, though, like 2 weeks ago or something.
We spoke at Spire, and I think one of the things that gave us a lot of hope is just how far things have come, and discussing, breaking down, learning why Skyrizi may be preferred over Stelara at a certain point, and then learning what they're doing with their own version they're creating 3 different types that are going to be similar, but more precise, more advanced. And it's really cool because they're going to take these 3 once they get, if they get there, hopefully they do, because you never know with these. They're going to start combining them. So you're going to have a dual biologic
in one, which is very cool. And on top of that, it's an injection.
Yeah.
Not an infusion.
Right. And they're also trying to get them where they are 3 months to 6 months.
3 months to 6 months, which is funny because I'm doing it every 2 weeks.
Yeah. And so it would change a lot of people's lives. It would make things easier with insurance. So that's a whole, I think I'd love to make that a podcast topic, something to talk about.
In the Crohn's.
There's a lot of hope, guys. And so even with treating joint pain, what was available, for a long time was just Remicade and was just Humira. And so now it looks like there's going to be more options. And I think the more you can get the inflammation and like really pinpoint what is going to work for somebody will help that joint pain.
Oh, definitely. Yeah.
I think that's because I think that was key with you was once it was under control, it was like, boom, it was gone.
Yeah.
And that was with Stelara. That was incredible.
That's interesting.
So
it also might have been that, how Remicade wasn't really like helping.
Yeah, it wasn't. So maybe
and it said some of them were based off of the colon health.
Yeah, and so maybe your colon was just getting worse.
Yeah, so it was just getting worse. So that's why it was seeming like it was worse. So there's a bunch of different things that this disease still isn't known about,
So that's why we talk about it.
Yeah,
because
to raise awareness.
Awareness.
Yeah. Awareness.
Raise awareness. But I think it's important for caregivers to know, things to look for, and it's important for you as patients to know, so you know Mason's experience, and yours might be different, might be similar, but at any rate, you'll understand, a lot of people think it's like, is joint pain part of this? Yeah.
Yeah, it is.
It is. And so good to know. And also another way for you to monitor your own symptoms. I think like if you start noticing like twinging and joint pain, like that,
then you can
it's
be
like,
oh,
okay, is something maybe happening? So good things to note and to just really keep an eye on your own health with this disease. I think it's important. So that's it. That was our joint pain podcast.
And this wasn't a pain to do at all,
No. And I think it was interesting. I thought it was really interesting to see how it related and didn't relate to you.
Yeah, I think that was interesting.
Yeah.
So it seems like I had maybe 2 of the 3.
So you were diagnosed with peripheral, but what's interesting,
for sure.
Yeah, is the back. And so I think
the back one, yeah, and the peripheral didn't include that.
No. So I don't know. Maybe, and so that's our experience. So that's what's,
Yippee.
So
experience.
Yeah, with that, guys, you can follow us on Team IB Determined on Instagram. Follow the Reggie Project as well to participate in that.
Yes.
And you can listen to us on podcast stations like Apple Podcast, Amazon Music, Spotify, iHeartRadio, and
Buzzsprout has a link to a bunch more podcasts. There's a lot more that we're on, but they're not as popular. So
yeah, but we'll include a link so you can find yours where you like to listen to it.
And then there's also YouTube podcasts as well as YouTube videos. And so if you want to listen to us, there's YouTube podcasts, and then there's the YouTube videos if you want to watch and listen to us. And if you are watching us and listening to us on YouTube, make sure to like and subscribe. And if you want to be notified every time we post a new video, make sure to hit that bell icon.
Yeah.
Getting faster every time I say that.
Yes, you're doing really well. Yeah. And Mason's wearing a Santa hat.
Yes, I'm wearing a Santa hat. So if you're watching us, that's the perk. You get to see the Santa hat. Yeah, it's right here. Yeah.
There it is.
There it is.
Yeah, I was like, are you going to wear that? Because he's like, well, yeah, because over here we pretty much celebrate Christmas season till New Year's. And since we're recording this before, you'll be watching it after. But that's why Mason is still celebrating. So yeah.
Keep on the jolly spirit.
Yeah, well, might as well have some happiness with everything going on in the world. It's always good to have something joyful and something fun. So might as well. So with that, guys, we are going to see you in 2 weeks with a new episode.
Yeah.
And so
Happy New Year.
Happy New Year. And we'll see you in a few weeks.
Yep.
Bye.
We hope you will stick around, tune in, and reach out to us with your own journeys. We are excited to give you an inside view of what it takes to be a caregiver and what it's like to be a patient.
And most of all, we hope you'll maybe be able to apply something you hear on here that might help you in your own life. Sometimes life changes, and it's all about how you handle the journey.